Welcome to the Rooted Will Rising Advocate podcast, where Black health stories are honored, our voices are amplified, and we hold space for truth, healing, and change. I'm your host, Mahogany, and it's Maternal Health Mondays. And this is the first episode of our special Preeclampsia Awareness Month series, Silent Pressure, Understanding the Basics of Preeclampsia. Before we begin, let me share a story with you.
There was once a woman who tended a beautiful garden. Every morning, she watered the soil, checked the leaves, and whispered affirmations to her blooms. One day, she noticed something small. One flower seemed more swollen than the rest. Another had lost a bit of its color. She brushed it off. "Maybe it's the sun," she said. "Maybe it's nothing." But the next morning, the ground beneath her feet felt heavier, the air thicker, the blooms drooped without warning. Still, the garden made no sound, no cry, no visible warning flare, just quiet shifts. Until one night, under a violet sky, the earth cracked open, and the garden nearly withered away. Not because the signs weren't there, but because the signs didn't scream.
Preeclampsia is like that garden. It doesn't always shout. Sometimes it speaks in soft shifts, in swelling hands, a dull headache, or a flicker in your vision, but ignoring those signs can change everything. And here's where it gets even more alarming, especially for us as Black women. Let's talk about the numbers. Black women in the US are 60% more likely to develop preeclampsia than white women. And the danger doesn't stop there. We're also 5 times more likely to die from preeclampsia-related complications like stroke, kidney damage, and heart failure. Even when we have access to care, even when we speak up, we're still more likely to be ignored, underdiagnosed, or delayed in treatment. This isn't just a health issue. It's a systemic crisis. One that calls for more awareness, more advocacy, and more listening to our bodies, to each other, and to the data. That's why this series matters. That's why we're having this conversation. Let's break it all down, starting with what preeclampsia is and how it shows up in the body. Let's begin with a truth that's often whispered, but needs to be shouted. Black women are 3 to 4 times more likely to die from pregnancy-related complications. And one of the leading culprits, preeclampsia. Preeclampsia is a pregnancy complication that usually shows up after 20 weeks of pregnancy. It's marked by high blood pressure and can lead to serious, sometimes fatal health problems for both mother and baby if not caught early. But here's the tricky part. It doesn't always scream. Sometimes it whispers, or worse, like it says nothing at all. Some women never feel a thing. Others experience sudden swelling, especially in the face and hands, persistent headaches, vision changes like seeing spots or flashing lights, pain in the upper right belly area. However, many dismiss these as normal pregnancy symptoms, and sadly, too many providers do as well. In fairness to providers, the condition is tricky. Unfortunately, this difficulty in correctly identifying such a devious condition early doesn't bode well for Black women whose symptoms are sometimes ignored or plainly dismissed. Let's keep it real. The higher risk for Black women isn't just about biology. It's about bias, disbelief, and barriers in our healthcare system. Studies show Black women's symptoms are often dismissed. We're told to rest, to drink water, to stop overthinking, when what we really need is to be heard, tested, and treated quickly. Hypertension, already more common in our community, becomes even more dangerous during pregnancy. Add stress, lack of culturally responsive care, and systemic disparities, and the risks rise even higher. So here's what I want every woman listening to know. Know you're normal. If something feels off, trust your instincts. Track your pressure. Even if your doctor doesn't ask, you can keep a log of your blood pressure readings. Many local clinics or pharmacies offer free checks. Document symptoms, headaches, swelling, vision changes, write them down, bring them. Now, sis, before we even get into lab tests and treatment plans, let's talk about something that too often gets brushed off: fetal movement. You know your baby's rhythm, their kicks, the stretches, the rolls. And if something shifts, if they're suddenly still or moving less than usual, that's your signal. Please don't ignore it, because decreased fetal movement can mean your baby isn't getting the needed oxygen or nutrients. And when preeclampsia is in the mix, that can become serious very quickly. So if that movement feels off, speak up loud and clear. You're not being overprotective, you're being a mother. Now, let's say your provider is concerned. Maybe your blood pressure has been high, or you've got swelling and vision changes. Here's what you should expect and deserve to ask for: a urine test to check for protein, blood work to look at your liver enzymes, kidney function, and platelet count, fetal monitoring to check your baby's heart rate and stress level, and possibly hospital monitoring if symptoms are severe or you're far along. Depending on the results, your treatment might include medication to manage your blood pressure, magnesium sulfate to help prevent seizures, steroids to help your baby's lungs develop if an early delivery becomes necessary. And let's be real, sometimes delivery is the safest option, because the only cure for preeclampsia is giving birth, but that doesn't mean it has to be a crisis if it's caught in time. This is why listening to your body matters. This is why tracking symptoms and movement matters. And this is why you have every right to say, I need a deeper evaluation. I want you to check on my baby. What are our options if this is preeclampsia? You are not a problem. You are not a burden. You are a life bearer, and your health deserves urgency. An advocate, if you're able, have someone with you at appointments, someone who will speak up if you can't. That's it for today's episode of Rooted Will, Rising Advocate. If this message moved you or taught you something new, share it. Share it with a sister, a mother, a friend, a doula, or a doctor. Visit mahoganyspeakstoyou.com for more resources and articles about health and wellness and maternal health. Subscribe to Mahogany Speaks to You on YouTube for video content. Help us grow. We are trying to get our first 10,000 subscribers. It's daunting but doable with your help. Follow us on various social media platforms to get the latest in Black women's health and wellness. We're breaking cycles, we're building knowledge, and we're demanding better. Join me next time for episode 2, where we'll talk about how to listen to the body and speak up in the doctor's office, even when it's hard. Until then, stay rooted, stay rising. Preeclampsia may be silent, but you don't have to be. Your voice matters, your body matters, and your story, whether you're carrying life, have carried loss, or are holding space for someone else, is worthy of care, respect, and